Hey there, welcome. Today, we're going to talk about something that so many people experience but don't always understand: light sensitivity. We're going to dive into why a bright, sunny day can sometimes feel like an all-out assault, and what your eyes might actually be trying to tell you.
So let me ask you, does a bright day ever just make you wince? Or, does the glare from a computer screen or those harsh fluorescent lights in an office feel almost painful? If you've ever felt that sudden, overwhelming urge to just squeeze your eyes shut, then yeah, you know exactly what I'm talking about.
Well, there's a medical term for this: photophobia. Now, don't let the phobia part fool you. It has absolutely nothing to do with being afraid of light. It's a physical intolerance, a condition where your eyes and your brain basically interpret light not as something helpful, but as a source of actual pain. Okay, so let's get a really clear picture of what light sensitivity actually is. Because trust me, it goes way deeper than just needing to squint a little when you walk outside on a sunny day.
And here's probably the most important thing to get straight right from the start. Photophobia isn't an illness all by itself. A better way to think about it is like your body's check engine light. It's a symptom, right? It's a signal that something else is going on under the hood that might need your attention.
So, what does it actually feel like? Well, it can show up in a bunch of different ways. It might be a dull ache or even a sharp pain in your eyes. It could be that totally uncontrollable urge to squint or just shut your eyes completely. For some people, it can make their eyes water or even trigger some really intense headaches or full-blown migraines. Sometimes people even start seeing halos around lights. Okay, so if light sensitivity is just a symptom, then what's the actual cause? Well, this is where it gets interesting because the list of potential triggers is surprisingly long and really varied. The potential causes are all over the map. It could be something directly related to your eye, like chronic dry eye, or maybe a tiny scratch on your cornea. But it can also be neurological. Migraines are a massive trigger for a lot of people, and so are more serious things like meningitis or even a head injury. And get this, it could even be a side effect from some pretty common medications.
This is exactly why it's not something you should just try to power through. That alarm bell is ringing for a reason. Ignoring it is kind of like hitting the snooze button on a fire alarm. It's a signal that really needs to be investigated.
So while you're maybe trying to figure out the root cause with a doctor, what can you actually do in the meantime? Let's talk about some really practical ways you can manage your environment and start taking back some control from all that harsh light.
It can start with something as simple as the light bulbs you have in your house, because not all light is created equal, not by a long shot. Warm light, the kind with that yellowish, cozy glow, that's generally much gentler on the eyes. Cool light, on the other hand, has more of that harsh blue light, which can really crank up the glare and eye strain. So for sensitive eyes, sticking with warm light is almost always the better bet. And here's how you can actually do that. First, when you're buying light bulbs, look for ones labeled soft white or check the Kelvin rating, that's the K, and aim for something around 2700. Second, installing dimmers is a total game changer. It gives you complete control over the brightness. And third, hey, never underestimate the power of a good lampshade to take that harsh, direct light and just soften it up. Now, for the great outdoors, your sunglasses are your absolute best friend, but you got to get the right kind. Make sure they offer 100% UV protection. That's completely non-negotiable. Polarized lenses are also fantastic because they're designed specifically to cut down on that blinding glare that bounces off of flat surfaces, like a wet road or the water. And maybe consider wraparound styles that block light from sneaking in from the sides. Okay, we've talked about managing it, but that's really just one piece of the puzzle. It is so important to know when your light sensitivity is more than just an inconvenience, when it's a warning sign that you really need to take to a doctor. So I want you to ask yourself, is this a totally new problem for you? Has it gotten way more severe lately? Or is it just kind of steadily getting worse over time? If the answer to any of those is yes, it's probably time to give your doctor a call. And here are some very specific red flags to watch out for. If your light sensitivity starts really suddenly, especially if it's painful, that's a big one. If it comes along with other things like blurred vision or redness in your eye, that's another. And listen, if you have photophobia plus a bad headache, a fever, or a stiff neck, that could be a sign of a serious infection like meningitis, and you need to get medical help right away. In some cases, really severe and persistent light sensitivity can actually be a symptom of a larger condition called low vision. Now, this is a term for sight loss that can't just be fixed with regular glasses or surgery. It really drives home why getting a proper diagnosis is so critical, so you can either treat or rule out these more serious long-term conditions.
So let's wrap all this up by looking at the path forward. How do you take all this info and actually use it to protect your vision and feel better? If you take just one single thing away from this whole explainer, please let it be this. Getting an accurate diagnosis from a doctor is the first and, honestly, the most important step to getting relief. Whether the fix is something simple, like special eye drops, or something more involved, you have to know what you're treating first.
So the next time the light feels too bright, don't just dismiss it. Take a second and listen to that little alarm bell. And just ask yourself, what could my eyes be trying to tell me about my health? Thanks for tuning in.